Hello, everyone. I'm really excited to have Emilio Galan join us from Robin Healthcare here on Social Leverage Foundersations. Welcome, Emilio.
Thanks, Gary.
Where are we finding you these days?
I, for the moment, because we can work remote, in Hawaii.
Not a
Um,
bad place to be.
not a bad deal. I can't complain. We're on Oahu. Um, Very fortunately, my wife is from here and grew up here, and so there's a very good reason why we're here. We are about to have our second child, and her family's here, and so we'll have that support.
Amazing. Congratulations.
Thank you.
Before we get into it, why don't you tell us a little bit about Robin Healthcare?
Yeah, Robin is the result of 5 years ago, myself and my co-founder Noah were uh, really looking for a way to fundamentally cause a shift in some of the broken aspects of the healthcare system in the US. And through lots of debate and founder dating discussions, we arrived at Robin as the way that we thought we could do that, which is if you're going to start trying to untangle something as complex as the healthcare system, uh, so many players, so many entrenched systems, insane technical debt, um, poor data at baseline, regulatory compliance considerations. Uh, our opinion from the beginning was you have to start with better data, and you have to be in the room as far upstream as you can possibly be to do that. So get a device in the exam room, support physicians, support patients as they're trying to navigate towards better health. That was the beginning. And very little has changed from that initial perspective, besides lots of work and going through the process of building the device and deploying it, et cetera. But fundamentally, why we're here and why we think Robin has an important role to play is because of that.
So you're in healthcare, which is challenging, and then you're also a device company, which is challenging. Any other challenges that you want to throw into the mix?
You've got devices, you've got software, you've got a significant human workforce to make all of this work together in a market that we'll say is incredibly resistant and insulated against change. Uh, it's a lot to come together, but that's what it takes.
Is
That's what it
there,
takes.
I mean, obviously, there's lots of folks that have tried aspects of what you're doing, or maybe even the full gamut. Is there,
Yeah,
is there something that you fundamentally believe that they've missed, or maybe the timing is right? Like, why are you going to be
sure.
successful when they haven't, or maybe the right answer is much more successful than they have been?
Sometimes what I'll say is that the road is littered with dead companies that have tried to solve healthcare in equally aspirational ways or fix some of the fundamental problems in equally aspirational ways. I think that the approach and the context and the industry perspective is the key. Um, I would uh, then argue with folks that really the most important thing is figuring out what the problem statement is.
Right.
Figuring out what the problem statement, you've got lots to choose from. I'd say that a superficial, maybe first glance problem that someone might guess is, oh, doctors are in the room working with the patient, and then they've got all this note work that they have to do that they hate, and they need to get that in the EMR. So problem is, how do we get doctor note into EMR faster, cheaper, better? So how do we get that note in the EMR with less requirement from the doc as quickly as possible? And the companies that have tried to solve that problem, the uh, solutions invariably, or the metrics of success invariably, are how do we do the transfer of what happens in the room into a node in the EMR as cheaply as we can. Um, and so the actions I see done are like, let's offshore in India, put a workforce over there. Let's have the doctor actually say more, dictate more, so that we can use dictation to do some of that transfer. Um, let's deeply invest in the EMR integration so we can automatically post it. It's really from doc into EMR as quickly as possible. And I think that's the wrong problem. Like, rewind this meeting or this session like 5 minutes. What's the biggest thing we think? You've got this massive, incompetent, poorly performing, expensive system that is insanely complex. And the most important thing we can do is get a good data set. Good data, or let's say bad data, is the problem. And when you zoom out from the exam room, the doctor who's trying to write notes and get into the MR, if you just zoom out from that view for a second and you look at how that is used in the broader ecosystem, when that doctor finishes that note, there are so many people that could use that data to do things like try and get paid, try and meet compliance requirements, trying to report quality, trying to get authorized so that that patient can get that MRI the doctor wanted. Uh, Try and join a network or join a specific plan or a group. The uses of that note that that doctor produces in our system today, we've got one doc, 11 administrators. That's the ratio. All kinds of folks are touching that data, and bad data is our problem statement. If we can just get that data set as far upstream as possible into an ideal state, or let's say closer to an ideal state, so many of those inefficiencies and that incompetent performance downstream gets resolved. That's our framing. I think that that's the biggest difference between us and some of the other folks that are scattered along this trail that maybe haven't made it.
Do you think you reached that viewpoint because you're trying to solve more of the problem and they were trying to be point solutions to part of that problem, or is it the timing? Is it changes to regulatory? Like, what's the thing that you think led you to get to this point where others haven't?
I worked for insurance companies, state governments, and a whole bunch of other folks before I went to medical school. And so by the time I was like, oh God, this is awful, doing the note and messing with the EMR and not being able to focus on the patient encounter here is the worst part of my job. That came after the, oh my God, our data's bad, our data's bad, our data's bad, our data's bad, our data's bad. And so I think those two things coming together was certainly an important clarifying moment. End of medical school, my attendings, the folks I was learning from, the folks I was like, do you like your job? Should I also be a urologist or an ENT doc? Or like, I'm quitting. I am out of here. I have got, like, me having that
And welcome
moment.
to the field.
Yeah, I'm not sure that, yeah, the future of medicine is really in question when doctors are quitting and burning out and saying they don't want their kids to go into healthcare.
What's what's the stat in terms of the administrators that are involved in the process relative to the doctors?
1 million docs in the country, 11 million administrators. So 1
Wow.
to 11 is the ratio. In this country, we waste about $1 trillion on billing and insurance related activity, which is all this data work I'm talking about. $1 trillion out of 3.8 trillion. We spend more on the waste than most countries do on all of the healthcare services combined. More than half of docs are burned out, depending on the study. It's 65%, but it's more than half. And similarly, more than half would say, I don't want my kid to be a doctor.
First time in history, probably.
First time in history. This was like the ultimate, I'm a doc, my dad was a doc, my mom was a doc. And more than half would say, I don't want my kid to be a doctor. And me having that experience while doing medical school, especially at the end when I was trying to figure out what kind of doctor do I want to be when I grow up for residency? With the history of we have bad data, we have bad data, we have bad data, we have bad data. It's like, oh my gosh, we are killing our docs. We're burning them out to produce bad data. It's
Yep.
like it's just a double whammy of ridiculous. So that's where we came at the problem is bad data, and if we can automate the capture of good data, this waste goes away, this burden goes away, and there's a ton of value for the company that does that.
It's awesome. I want to get back to Robin, but let's first go back to how you got to this point. I mean, starting a company is so hard. So clearly, you got advice that maybe you shouldn't be a doctor. But going back further, tell us about your background, any entrepreneurial roots that you have. Like, how'd you get to this point?
The abridged version, I was born in Puerto Rico, parents kind of low middle class, came to California because they were doing a bunch of recruiting of Puerto Rican engineers. Uh, Ended up watching them kind of work super hard and get established. And it's a I was the first person in my family to go to medical school. And frankly, my mom was like, my son is going to be a doctor. It's just like one of those things that happens when you're young and your mom's like, oh my God, you're so good at taking care of people. Wow, like when I was sick, you brought me the bandage. Like, you're going to be a really good caretaker, aren't you? Like, asterisk, be aware, mom is pushing this.
Right.
Dog. And that continued, frankly, continues to this day. The uh, I think biggest moment is in high school when things start maybe, I don't know, start getting interesting. Uh, Again, my mom is talking to someone at a gym who is a doctor, and she asked, "Can my son volunteer with you?" And what she didn't know, I'm a sophomore in high school, and I start volunteering with this doc. What she didn't know is that that doctor was actually not really practicing anymore, but had a startup. And the startup was and getting healthcare services. There's like so many obstacles in the way. You got to do the appointment. They have to do the insurance validation. It's like, it's painful to actually get the care. And so, what if we made a Kinko's like experience for healthcare services? That's what this guy's, Dr. McCauley is his name. And he started a company called Wellness Smart. And so I started working here, and instead of doing what my mom, I think, imagined, getting used to in clinic and a standard patient care experience, I'm learning how Wellness Smart works, which is very early in those days. And it had to do with you are going to get a high deductible health insurance plan, so a specific type of insurance plan, and then you're going to get basic routine care needs met here in a very convenient way. And then if anything big happens, then you'll access the traditional healthcare system. That was kind of the idea. So an insurance plus care, convenient store, I guess is how I'd say it. And it threw me right into the deep end of a lot of healthcare problems. My job, right out like sophomore, I'm driving an old Camry. I'm going around, and my job is to go to healthcare clinics and imaging centers um, around the area and say, "Hey, we have this convenience store thing, and if people need to get services outside of that convenience store, we want to know where to send them. What is your price for an X-ray? What is your price for an injection, an office visit? How much does it cost to see the doctor here? Just so we know what to tell our folks when they need services outside of what we can provide."
This is like old school cold calling without calling. You're actually
So
driving.
I'm driving in. I'm a high school student. Okay, so and I was short. I was like 5'2", 95 pounds. I looked much more like a middle school student. And the first thing that these folks would ask me was like front desk. Right? They'd ask me, "What are you doing here? Why are you in school? And why are you asking me these questions? Kid, there is no price. I don't know. Like, do you know nothing about healthcare? There's no such thing as a price for the X-ray. What do you mean? What's your insurance? What's the CPT code?" Like I need to know all these things to get to a price. There's no price. I don't. And again, I think innocent and naive and appropriately so, I said, what the hell you don't, what do you mean there's no price? Like I'm used to, I mean, all my only experience, I go to the supermarket, I buy something, it says $4, I buy it.
Yeah.
There's a price. What do you mean that we just want to know the price? Why can't you give me the price? And there was just like this, I don't understand. Um, that sent me down a rabbit hole.
Yeah. What happened with that startup?
Okay, so they were in when I started. They were actually they had a kiosk in that gym that I mentioned that my mom went to, and now I think they've got 25 stores. This is really like finger in the air. It's been
Right.
open
Right.
since. I mean, 25 stores, 10 states, something like that.
So probably not VC backed, but a
Now VC,
great
no, no, no. No. When I told
regardless.
Dr. McCauley I'm doing a VC backed business, he's like, "Why? Why?" I think he still.
Well, sorry to help drag you down this journey then.
He's like, "Come on, no, just build it organically and keep all the ownership." I think he probably still owns like 99% of the
Right.
business.
Yeah. I guess you didn't get any equity driving from
I
place.
have no equity, which at some point I'll have to circle back and say, "Hey, McCauley." Yeah,
Great story. Really appreciate it.
sure.
So I guess getting back to Robin, give us a sense of where you're at. Like, what's the scale? How many people? Like,
Yeah, easy metrics. So we started 5 years ago, almost 5 years ago, February 2017. And I told you why we started it. I told you that not much has changed about why we're here. Honestly, not even all that much has changed in terms of how we've been approaching the problem. It's been, frankly, five, almost 5 years of what does good data look like in such a complex, regulated,
same problem.
challenging market. I mean, figuring out, okay, now I'm in a place where I am supporting physicians and solving that burnout problem. Absolutely. I doctors say things like, I would have quit if I didn't have Robin. That burnout, that has been solved. We save the average doc 90 minutes a day now of the work that they hate most. And doctors would tell us the actual care I can provide is better. Like not having to worry about these check boxes and these specific things I need to get done to get paid to do compliance, blah, blah, blah. Just that lets me actually have more of my brain capacity focused on the patient and have a more natural conversation with them. That is amazing. The question to solve the other side, which is we're getting bad data and we're burning out doctors. The good data side, it is not immediately obvious. It was not immediately obvious to us when we started. What does good data look like? We probably had 20% of a clue when we started. At this point, I think we're at 80% of what is
A lot
the
of progress in a few years.
what's that?
It's a lot of progress in a few years.
Yeah, yeah, it's a really hard job. I'd say it's definitely taken. That's where we've put our biggest effort, brightest minds, is figuring out what does good data look like in this market, and do such an important job of actually supporting health and healthcare, and progress still room to grow. But what does that mean? There are metrics that I can point to along the way. Is that burnout piece solved? Doctors save that 90 minutes. They get to focus on patient, do what they trained to do. We have avoided doctors quitting. Like we have prevented doctors quitting because they use Robin, which is so gratifying from my, like, I was in training and I saw doctors quit.
Yeah, like you've had fantastic quotes from doctors too, just how they get to spend more time with patients, how they get to spend more time with their family. It's like, I mean, it all leads to not burning out and not quitting. But
My wife would leave me if I stopped using Robin, like things like
right,
that. It's like, so really impacts so many aspects of better care and just doctors who actually want to continue practicing. Like if we could have more doctors start saying, actually, I do want my kids to go into medicine. Like that is a possible outcome of what we do there, and that's huge for me. The other side, on the data side, yeah, at this point, we as far as I can tell, and we go in the way that we do our implementations is we go in and we do an analysis of how the practice is performing in terms of good data. And the way that we measure good data is compliance, accurate reimbursement, risk, liability. How much do you have to spend on your medical malpractice premiums? Things like that all come back down to the data they're collecting. So we do a baseline, and then we install Robin, and we see how much it's changed. We have not seen an environment, uh, a practice, a system, a technology suite that these folks use, a vendor, a competitor, uh, that comes even close to the output. And I think it's like a rough number is we always see about a 50% improvement, that level. We're not talking about 1-2% change, a 50% improvement
Yeah,
in where they are. What's that?
it's dramatic.
Is a
Dramatic.
dramatic change. And I would argue the reason for that is because of the problem statement. You got to start with the good data. And so many of these current functions that I just mentioned that we measure are dependent on bad data today.
So I'm sorry to press on this, but anything else you could tell us more about kind of where you are in the business metrics beyond saving doctors 90 minutes a day? Is it, how big is the company? Like how many encounters do you have? How fast are you growing? Anything that you can give us to give us a sense.
Sure. Yeah. Simple things company wise, about just crossing over 100 employees at
Wow.
Robin. Yeah. And so that's exciting. Also, frankly, a little bit nerve wracking, which is as we become a bigger company, we don't want to lose the startup mode. And been reading a lot of books on how to maintain a environment where people can still make vast progress quickly, um, and not become a gridlocked politicking machine. And so that's definitely the 100, crossing over the 100. A few of the books I've read say at the 150 mark is where most companies start getting rigid and it becomes about politics. So we are actively prepping for that moment to try and avoid that. Uh, in terms of encounters, yeah, mostly what we think about is encounters that we process. We get paid per encounter that we process. We uh, basically staff based on how many encounters we're processing. The technology is all about in processing these encounters. We're doing about 15,000 a week now. And the end of year
That's
looking.
essentially a patient visiting a doctor. That's what an encounter is.
Yeah, sorry. I'm using yeah, exactly. That's a patient visiting a doctor. There was a encounter that happened between a doctor and a patient, and all kinds of things need to happen after that visit to make the system run. And so we're making sure that each of those visits have an optimal after visit performance, and that doctor can just focus on the patient during the visit. And looking to about double that over the next quarter, which is a big moment for us. But thankfully, the team is there, and we've got. I don't know if you want me to mention the most recent fundraise.
Oh, please.
Yeah,
Good news, huh?
yeah. Part of the reason why we can do that is we just raised our Series B. So total $50 million raise. Really, um, thanks to social leverage. Thank you for supporting. IA, Meridian Street, Norwest continuing on to support us after they had done the A, and then bringing on two new investor partners, Scale venture partners with Roy O'Driscoll and Khosla Ventures. And two things have happened there. Is obviously we have more resources, so we can push a doubling in a quarter. And uh, second is I actually really like the folks we have on the board. I think Scale it has a track record of doing exactly what their name implies, is pushing scale at businesses that we all know. And Khosla, I I'll never forget sitting down with Vinod, and he said, Emilio, I am going to ask you to do one thing. It might be different than what everyone else asks you about. Um, I'm going to ask you to go bigger in impact, build the biggest possible, most impactful business you can. And I'm not going to be thinking about the standard VC metrics. I actually want you to have impact. And those two things, I just uh, felt like a really special combination.
Well, clearly you started this business to make an impact, so that must be music to your ears, and probably why Koso is part of the team now. So,
Yes, you could say that. You could
yeah,
absolutely say that.
yeah, that's amazing. I mean, I think they're fantastic investors, and obviously putting fuel on your fire is super helpful, and will let you do the things you need to do. So, congrats to you. Um, I want to, obviously I'm very familiar with the business. I'm just wondering, in our conversations, I'm not sure if our viewers will get the full kind of scale to which you've already grown your solution, your footprint. Can you
Yeah.
just maybe talk about like the different aspects that you actually interact with? Like you've got a doctor app, you've got patient apps, you've got, obviously the back end interface where you do the magic, but can you talk about some of those things to give us a better sense for kind of truly what Robin is when it manifests itself?
Sure. Um, yeah, if we say, what does good data look like?
Yes.
You have a device in the room, right? So there's over 1,000 devices out there in the wild, in exam rooms that people go into, and uh, that device is the primary data source. So well over 50% of our data comes from that device in terms of what we use every day, and what ends up being important to support the doctor and the patient. Uh, the other data sources, of course, are the things that happen outside of that room or before that visit with the patient and doc. And so we are pulling down historical, so lots of systems in place to pull down information out of the EMR, and even bigger than that, things called HIEs. And then there are things that happen outside the room that aren't historical. And so we have applications on the phone for the doctor to also be able to interact with Robin. So if they're away from a device, if they're on a walk, they still have Robin with them. Um, the build the best kind of foundation for healthcare that we can problem requires all of those pieces coming together.
Yeah, tough challenge, tough problem to solve, and I know that you've grown your footprint in the practices over time because you're trying to fix the data quality issue at
Yep.
heart. So makes lots of sense. Let me ask you now that you've got this funding and some great investors on board. Like, what's the biggest challenge over the next 12 to 18 months? Like, what do you see as things that you really need to get done?
Um, I will always have that. Okay, there's still 20% of a data model getting figured out. And so I feel really good about being at 80% now, but we just won't stop thinking about the data underneath the hood. The I think biggest challenges as we look to what we're going to do with the funding and over the next couple of years, I think is really getting the solution out to as many of those clinicians that are struggling with burnout and as many of those clinics and systems that are struggling with bad data as possible. And uh, we've talked about just how complex the orchestra of this business is. Hardware, software, there's multiple interfaces, There's pulls out of legacy systems that need to happen, and then there's a workforce behind the scenes also doing quality assurance and all the data, making sure that all of that can work effectively, and that orchestra is kind of performing in unison is, I think, the key to scale. And so there are a million doctors out there. Um, More than half of them would say that they're burned out. More than half of them would say that they would consider doing something else outside of medicine. Uh, and we spend uh, unreasonable amount of money on waste. And so the need is there. Let's get the solution to them. And so
When
big,
you
yeah, go ahead.
when you talk about a million doctors, are there some that are better fit? I mean, whether it's specialties or the types of practices or the size of practices or the states that they're in, or is there anything else that at least over the next 18 months is a better fit than others?
Yeah, there's, I think, two things go into that, which is first, like, who are the best doctors to work with for Robin? What the best environment for us to work in? And then there's like the economic question from a, if we're going to invest our resources in bringing on one group versus another, what are the things that we decide internally are going to make that selection? And that's just as we're cranking up capacity, we have to make those hard decisions of who are we going to decide to support. Uh, in terms of what what the characteristics are that we like, we want to get as close to the doc as possible. That, like, to get to that like burnout, like what you need doctor question. And the larger the healthcare provider entity, the decisions are being made further and further and further away from the doc. And so when we look at a group and we're evaluating, one of the criteria is how direct to the doc can I get? Because a huge part of our solution is relieving that problem of the burnout. And so we look at groups that have that streamline. The doctors are involved in the leadership. The doctors clearly have a voice when making a decision of what gets implemented. And it's not just like here's your next terrible to use EMR. You have to start using it on Gen 1, like that doctors are involved in those decisions. And then the second, I think, is uh, groups that understand that there is a problem. Um, you think it'd be obvious, maybe, like clearly healthcare has a problem. Clearly, we're insanely inefficient, and that bad data is pervasive. Uh, I think often when you get to a group that or a healthcare system, there's there can be some, they clearly know their situation, but they don't know how to evaluate the importance of their data in the equation. It's just not how they've approached it. They've approached it with building up their staffing or outsourcing a staffing system, or um, and so when we go in and say, no, let's actually look at the impact on your system of practice of having bad data from burned out docs. Um, there's just education that needs to happen there. And so I think I look for a lot of alignment across the aisle. We need the docs who are just like, I just want to stop doing this work that's completely destroying the reason why I went into medicine. And we understand the value of data and how important it's going to be for our system economically.
Got it. What about just regulatory going across state lines? Any issues that you guys have to worry
No
about?
state line issues. Very, very, very few. The regulatory is something that we are thinking about all the time. Part of what made healthcare so complex is that it has not been able to evolve as a standard industry. The biggest changes in the healthcare industry have happened due to regulatory kind of federal policy changes. And so it is the state of the world that a policy change can completely shift the economics. and what does it mean to perform, and even what data you need, because it all goes back to that. And so, especially when you have a change in the White House, people, healthcare veterans, Scott over at Meridian right now is like, what's happening? What are the policy shifts? Because it drives so much of what the requirements are, for so many healthcare systems.
And
So
you guys even saw that at the beginning of this year, right? Coding
January
changes.
1, 2021, biggest change in a very common code sets rules in 20 years. And so we're bouncing along just fine. We're producing really good performance. The data under the hood is good. And then policy change. And this is the first big policy change that's happened that's relevant for us, since we started. Obviously, we've got some historical context, but it's like different when we're on the front lines. Our performance dropped significantly because all of a sudden it was new data, new rules that need to be evaluated. And then it took about a month to get back up. And
But individual practices would have the same exact issue that you guys had, right?
yeah, I think the average response. So in our case, big policy change. Okay, the whole system needs to be updated across all of our practice, across all of our visits, across all of our docs. That's a code change, and it needs to be done. It's work, and then the system needs to learn how to perform with those new requirements, and that takes about a month. The standard solution to that is much more challenging because your data capture mechanism is actually individual frontline doctors and clinicians. And so how do you update not one system that's doing the data capture for the clinic or across clinics, but how do you actually update the mental model of hundreds, thousands of individual physicians or clinicians that support them or MA staff, but frontline actual providers of healthcare? How do you update? And it's like webinars, banners, consultants come in and do like a side by side. It's just all of the things you would think to try and tell me as a frontline doc, hey, you need to start doing this new thing. So we saw a hit, but certainly there's an advantage to having done that at Robin versus what.
Yeah, you're doing it at scale across practices, so much more information and data and
Yeah.
awareness. So yeah, that's awesome. When thinking about the challenges over the next 12, 18 months, I imagine hiring is probably one of the big ones too, right? Like any specific roles that you're thinking about, any categories of roles that you're trying to hire for?
Yep. 12, 18 months. The challenges of scale, big umbrella. And many of these are not specific to healthcare, not specific to our specific business. It's just the challenges of scale. And one of those is scaling the team. We are growing the team quite a bit. And when we're thinking about who we're looking for, and if anyone watching this has recommendations or interest, no doubt, right? Engineers across the stack, back end, front end, every kind of engineer that joined the tech. Lots to build. There's interfaces for the doctor. There's interfaces for internal team. There's a huge data model. There's a bunch of automatic processing that happens on it. If there's a technical skill out there, I think it can be applied to Robin. So we're looking for definitely engineers, and there's lots of data questions, just going back to kind of problem statement. And so data engineers also, or in particular, looking to really build out that team, see what we can do with the data under the hood. And outside of the technical roles, I know product is growing, the design team is growing along with the engineers, because we keep those teams pretty balanced. But outside of that side, I think it would be VP of Finance. We are currently hiring, we're currently interviewing candidates right now. So hopefully by the time this is released, it's not a need, but just in hey, still let me know if you have a recommendation. VP of finance is huge. It's huge because there's a ton of finance work just to do with scale, period. Not specific to Robin, not specific to healthcare. But then you add on like what Robin does and its complexity and what healthcare is in its complexity and the finance leadership that can bring all that together is really critical and I think has been hard to find. And then on a VP marketing, I think I mentioned um, right now we honestly thinking about marketing more so about just getting the word out there of who we are um, and making sure we can bring in the best talent. Uh, as I mentioned, uh, right now we have to choose like which group to implement versus not. So uh, as we scale, marketing for actual leads is going to be important, but that's not the most important part right now. It's actually finding
You're trying to do marketing so talents can find you. It's
exactly get the word out there. Big mission driven business is over here if you want to check it out. Getting that word out there is what we're thinking about primarily.
are you just for people that might be interested? Are you hiring people all over the states, all over
Remote.
the world?
Yeah.
What's
Yeah. The phrase we've been using, work remotely, play together. Remote work, lots has changed, obviously. And that's where we've landed for the time being. And it's working out so far.
You have a couple of areas that you're geographically clustered around, though. Is that right?
Yes. I would, frankly, actually, I was thinking this morning, like, oh, it'd be nice to everyone be on the same time zone because then we can have a meeting. And I know it's at the beginning of
Right.
every day.
Well, you're
Everyone's
screwing that up right now. So
yeah, I know. Right now, my day starts early. Um, the but the areas where we have more folks, more concentration: Bay Area, San Diego, increasingly Los Angeles, Chicago. Lots of the design team in Chicago. Portland has been growing.
100 people, we got lots of pockets now. So
Yeah, Austin is probably where we've got most people at Robin. So it's fun if you can be in person, if you happen to be in person. But if you're remote, we'll just make sure that we get together so that we can get to know one another.
awesome. You touched on this, but for yourself personally, now you're the CEO of a very fast growing business. Like, what do you do to, or what do you think about being the best leader you can be? Whether it's reading books or other tips and tricks. Like, what can founders think about that you're doing that they might want to mimic?
Yeah. Okay. I have a CEO coach. I was so skeptical. And oh, yeah. Oh, yeah. I put that as number one. And what my CEO coach does is much more works internally on me, like helps me improve, much less about, hey, I've got this specific business problem. What would you have done in this situation? It's actually, Emilio, let's work on you so Emilio can get to the place where he's able to emotionally handle and process what's happening at the business. The key that I've taken from those conversations is like what he would say is CEO is chief emotional officer. Like my ability to recognize my emotions and then calm or handle or stabilize those emotions to then be able to recognize the emotions on my team to be able to create a space where those can be stabilized so that we can actually function and solve problems is the fundamental job. And I just have found that really interesting and helpful. And I use it all the time now in my day to day. Outside of the CEO coach, I've been reading more. I always used to just read sci-fi because it was like, no, reading's my time. And this is the first time I'm reading. Uh, now that we're kind of growing, and I'm seeing my role change, reading more business books. The feeling I have is like, oh, I'm so happy I didn't have to do that mistake myself. Oh, thank you for telling me that. I'd like to learn off of your mistakes. And I think that that actual phrase is one of the phrases that Ben Horowitz uses in one of his books. Um, I'd what's yet to be seen is how much I'm retaining, or am I still going to learn firsthand? I hope not. But just reading through it, it's like I'm trying to keep as much of it in my head as I can, but it's just a lot. It's a lot of things
At that
happening.
point, it's funny, but obviously, I give founders advice all the time for whatever it's worth, and I think that there's an inclination to kind of learn for yourself. Like you have to like get burned by the stove before you realize that it truly is hot, no matter how many times someone tells you that it's hot. So I'm sure you'll get some value reading these things, but I think you'll probably experiment for yourself too. I think it's just an inevitability. You have to go through it yourself to truly understand it.
That's what I'm afraid of. Yep. That's exactly right.
All the power to you. That's awesome. Thanks for that. Howard would be disappointed in me if I didn't ask, but what are you doing in public market investing? Are there healthcare companies that you're excited about? Any thoughts there?
Yeah. Okay. Public investing. Am. I think I mentioned to you, I'm not the most sophisticated public investor. That's for sure. My co-founder, I regularly call Noah, and I'm like, no, what are you doing? What should I do here? I use Robinhood. That's my level of
Yes.
engagement because it's really easy, and mostly crypto just because I heard it said enough times, like, well, if the thing does go to a million, I would really be disappointed in myself that I didn't just do it. So I just like bought one. Um, and then beyond that, Amazon, because it's like, okay, that seems like a safe bet. I mean, they're owning retail and the e-commerce and the for healthcare.
And the
Just
startup tax too. Don't forget about that.
Okay. Okay. Amazon, just because it's safe bet, no qualification needed. And I think for healthcare, it's been such an interesting time. Oh my gosh. Uh, with COVID, the regulatory constraints around the market have changed dramatically, which in this market opens up so much opportunity. And so first I was like, okay, I got to invest in a couple of telehealth companies. No state line rules. You don't need the doctor in Michigan to be able to deliver service for someone in Michigan. Holy mackerel. And frankly, both of the ones I invested in have not done all that well. So
Happens to investors.
yeah. Caution, don't listen
Yeah.
to me. And the other, in terms of companies I'm excited about, got to throw out props to a company like Unite Us. Oh, I just love Unite Us. Um, yeah, I think companies that are thinking outside the box of what healthcare is, like redefining it, um, I think are really interesting. I don't know what the future will hold for them because healthcare is so challenging to really innovate and do something new. But the Unite Us, hey, it's not just about healthcare, it's also about social services. So they've got this thing that they call social care, as like that is what is under the umbrella of kind of our pursuit of health, and it should be funded as such. They're them pushing that envelope super interesting, especially as states and the feds are playing with things like global risk, geo model, whole person care. Um, it's just a fascinating space. And then I think companies like Oak Street, ChenMed, um, Village, who are thinking, how do we have more of a community based, kind of convenient way? I guess I'd throw One Medical, but more so their acquisition of Iora in there. Um, and then how do we create that community of patients and clinicians so that we can show population level improvement economically and outcomes? I think is when I look at the diseased cow that is healthcare, like the massively bloated, completely ineffective system, and then you've got folks like that actually looking at population level to improve outcomes, reduce spend. It's like somehow, some way, something like that should be able to cut out a ton of this waste and poor performance. Um, how long that will take and how rocky the road will be. I think my biggest fear for them is they end up being kind of contracting administrative arms, and that's it. They're just another layer of middlemenary in this complex system. That would be my concern, but it's an intriguing idea, at least.
Got it. I look forward to the day when I ask the founder of this question and they tell me that they invest in Robin Healthcare in the public markets. So maybe one day. Um, so I think we talked about it, but anything to reiterate in terms of how viewers might help you? I know we talked about the hires, definitely on the engineering side, the VP of finance, marketing, data, and then practice intros. Sounds like that might be something helpful as well. Anything else, or do you want to drill into either of those again?
No, I think that's exactly right. If you know anybody who is amazing and wants to join a company trying to solve a very hard problem and get their hands dirty, I'd love to chat with them. We'd love to chat with them. We're scaling the team. If you know any doctors, clinicians, systems, provider groups, IPAs, CINs, anyone in healthcare that wants to use Robin, you think would be a good fit for Robin. We're scaling the users, and I'd love also to be introed. Uh, I think those are the two real big things on our mind. And you mentioned data engineers specifically. I'm speaking to you specifically. We'd love to chat with you. Uh, our problem statement is bad data is killing healthcare, and we need your help to make sure we've got the best data to fix that.
That's amazing. Congrats so much on the path that you've been on so far. The fundraising announcement, getting the capital to really move you forward, and on the upcoming birth of new baby as well. So congrats on it all, and thanks so much for joining us. Really appreciate it.
Gary, I have you to thank for all of those things besides the birth of the baby part. And uh, you were the first investor, man.
Appreciate it. Appreciate
Uh,
it.
thank you for believing in us 4+ years ago, and joining us every step of the way.
Awesome. Thanks, man.